This short module is designed to provide a brief review of the Centers for Disease Control and Prevention recommendations for safe injection practices. The module includes information on hand hygiene, vial handling, and needle and syringe use. References have been included at the end, as this is not a comprehensive review of all infection control practices.
Hands, especially the hands of healthcare professionals, are the most common way germs are spread between individuals. Therefore, the easiest and single most important factor in the prevention of pathogen transmission is good hand hygiene. Hand hygiene is a general term that applies to either hand washing, antiseptic hand wash, antiseptic hand rub, or surgical hand antisepsis. You should perform hand hygiene by washing hands with soap and water or using an alcohol-based hand rub before patient contact, immediately before any aseptic task, after an exposure to body fluids, after patient contact, and after touching any object or furniture in the patient's immediate surroundings. Hand hygiene must also be performed before putting on gloves, after removing gloves, before touching other medical supplies intended for use on other persons, before handling food, and after using the restroom. The recommended technique for alcohol-based hand rubs is to apply the product to the palm of one hand, rub hands together covering all surfaces, and continue to rub until dry. It is during the drying process that germs are killed. When hands are visibly dirty, contaminated, or soiled, wash with soap and water. The recommended technique for hand washing is to wet hands with water, apply soap, rub hands together scrubbing both sides of the hands and in between the fingers, rinse and dry with disposable towel, and use the towel to turn off the faucet. Administrators, take note. Dryness or irritation of hands is often cited as a reason for non-compliance with hand hygiene regimens. Seek information from manufacturers regarding effects that hand lotions and creams may have on the effectiveness of alcohol-based hand rubs and/or antimicrobial soaps. Artificial nails should not be worn when having direct contact with patients. Natural nail tips should be kept to a 1/4 inch in length from the quick. Gloves are worn when there is potential for contact with blood, such as when drawing blood or starting an IV, other bodily fluids, mucous membranes, non-intact skin, or contaminated equipment. Always wear gloves during any procedure that involves potential exposure to blood or body fluids. Do not wear the same pair of gloves with more than one patient. Change gloves between patient contacts and change gloves that have touched potentially blood-contaminated objects before touching a clean surface. Discard gloves in appropriate receptacles. Additionally, make sure the gloves fit properly and, as mentioned earlier, perform hand hygiene before and after glove use. 3 vial handling reminders. Always disinfect the rubber septum of a medication vial with an alcohol pad prior to piercing it with the needle. Medication should be drawn out of the vial right before use. And if there are meds that need to be refrigerated, they must be stored in a clean fridge. No food storage of any kind is allowed in a medication fridge. Medications should be drawn up in a designated clean medication area. This means that the area where meds are prepared is free of used or dirty syringes, IV tubing, blood collection tubes, etc. It is important to maintain this practice to prevent contamination of medication vials. Additionally, meds should not be drawn up, prepared, or stored in a patient care area. A patient care area is anywhere a patient might receive care, for example, patient rooms, treatment rooms, or operating rooms. The pocket of your scrubs is not a storage place for medication. Single-dose vials are for use on one patient for one injection only. Single-dose vials should never be used on more than one patient. They do not have preservatives to prevent the growth of bacteria once the vial has been accessed. If the vial is reaccessed, especially with a used needle and/or syringe, there is potential for contamination of the vial. Medication remaining in single-dose vials after use should be wasted and not combined or pooled. Likewise, leftover medication remaining in a single-dose vial should be wasted and not stored. Multi-dose vials should be dedicated to a single patient whenever possible and not shared between patients. Dedicating the vial to a single patient decreases the risk of contamination. Like single-dose vials, multi-dose vials should not be kept or accessed in immediate patient care areas. This recommendation is meant to prevent contamination of the vial through direct or indirect contact with potentially contaminated surfaces or equipment often found in patient care areas. If a multi-dose vial enters the immediate patient care area, it should be dedicated to that patient only and discarded after use. A multi-dose vial should be accessed with a new needle and syringe each time, even if the vial is dedicated to a single patient. Open multi-dose vials should be dated and discarded within 28 days, unless the manufacturer specifies a different discard date for an open vial. Unopened multi-dose vials should be discarded according to the manufacturer's expiration date. We understand that drug shortages exist and resources are limited. However, this is not an acceptable argument for sharing vials between patients. Waste can be reduced by purchasing and using the smallest vial possible. Treating a patient for an HAI, a healthcare-associated infection, is far more expensive than buying vials of medication. In addition to single and multi-dose medication vials, intravenous fluids can also be a potential source of infection. Bags or bottles of intravenous solution should never be used as a common source of supply for more than one patient. Fluid infusion and administration sets, that is, intravenous bags, tubing, and connectors, are to be used for one patient only and disposed of properly after use. After a syringe or needle has been used to enter or connect to a patient's IV, it is considered contaminated and should not be used on another patient or to enter a medication vial. Syringes and needles are not to be reused, even if on the same person. One needle, one syringe, one time. To avoid contamination of the inside of the syringe and its contents, be careful not to touch the plunger of the syringe while drawing up or delivering meds. If medication is in pre-packaged syringes, the syringes must stay in the package until you are ready to administer them. The pocket of your scrubs is also not a storage place for syringes, whether the needle is attached or not. In summary, good hand hygiene is a must. Always perform proper hand hygiene prior to providing patient care. Hand hygiene should always be performed before and after any encounter with a patient. Always wear gloves during any procedure that involves potential exposure to blood or body fluids. Do not wear the same pair of gloves with more than one patient. Medications should be drawn up in a designated clean medication area. Do not prepare or store medications in a patient care area. Do not administer medications from a single-dose vial to more than one person. Do not combine leftover contents from a single-dose vial for later use. Do not keep multi-dose vials in the immediate patient treatment area. Do not use bags or bottles of intravenous solution as a common source of supply for more than one patient. The pockets of your scrubs are not a storage place for medication or syringes. And always use a new sterile syringe and a new sterile needle to draw up meds, even if for use on the same patient.
That concludes this module. If you would like to learn more about safe practices for injection preparation and administration, please visit www.cdc.gov/injection safety or refer to the references in the description box below.